Hi fifth years, we're going to talk about obesity in today's class. So today's way of life is less physically active than it used to be. People travel on buses and cars rather than walking, and many people work in offices where they're sitting still for most of the day. And this means that calories that they eat are not getting burnt off as energy, and instead the extra calories are stored as fat. So over time, eating excess calories leads to weight gain. And without lifestyle changes to increase the amount of physical activity done on a daily basis or to reduce the amount of calories consumed, people can become obese. Now, the stats are pretty bad. 1 in 4 children are categorised as overweight or obese. 6 in 10 adults, 1 in 2 pregnant women, and 3 in 4 adults over the age of 50 are overweight or obese. The effects of obesity are manifold. And ultimately, people who are obese suffer from many other complications just besides carrying extra weight on their bodies. A higher risk of bullying, for example, a risk of earlier death, a higher risk of pregnancy complications, and a higher risk of disability. Given that obesity is one of the most widespread medical problems in the Western world, with over 1/3 of adults deemed to be overweight or obese, and with 60% of the Irish population being overweight or obese, the government has come up with an action plan called A Healthy Weight for Ireland, which you can check out online. You can actually download the entire document if you want to read in it more. But the basic gist of it is that it's an obesity policy and action plan for 2016 to 2025 to reduce levels of overweight and obesity and to help people achieve better health. The contents of our class will first of all focus on revising and linking in with what we've done already on energy requirements of adolescents. We'll look at the factors influencing energy requirements. This is just revision. We've already looked at specific stats on obesity in Ireland. Now that'll come towards the end, and we'll look at the main body, the main content that we want to focus on for learning is the definition of obesity, being overweight versus obese, body mass index, causes of obesity, health risks associated with obesity, the treatment and dietary guidelines. And then we'll look at the role of exercise, dieting and snacking, especially in relation to adolescents and teenagers. So let's first look at the energy requirements of adolescents. Females between the ages of 14 to 18 years of age need 1,800 calories if they're sedentary and 2,000 calories per day if they're active. Males, on the other hand, between the ages of 14 and 18 years of age need 2,200 calories if they're sedentary and 2,600 calories if they're active. Of course, there are variations with the needs, the energy requirements of adolescents. The true energy requirement is more closely related to body size and growth velocity. In other words, how fast you might be growing at the particular stage that you're growing. So maybe when you're 15, you have a growth spurt and your energy needs become greater than what they were the year previous or the year after. The amount of growth that you grow during puberty corresponds to about 50% of what your final adult weight will be. And in this time, you're producing a lot of new muscle and new bone. And this requires a huge amount of extra energy. So of course your appetite will increase. And the challenge here is to manage this huge energy requirement without gaining excessive weight. So just to recap the factors which influence your energy requirements, they are your age, your occupation, climate, activity level, health status, pregnancy or lactation, gender and size. And just to make the point here that boys need a greater amount of energy than girls because of the amount of muscle they have in their body compared to girls. Girls have a higher proportion of fat, which isn't metabolically active and therefore doesn't require energy to function. So let's look at the definitions of obesity. When an individual's weight is 20% or more over their recommended weight based on their height, they are said to be obese. The HSC also have a definition that's similar, but adding on to that, if a person has a body mass index or a BMI of 30 or greater, they are said to be obese. This image is taken from BMIcalculatorireland.com. Now the diagram I'm using here has got the imperial measurements, but the same principle works if you get your weight in kilograms and divide by your height in meters squared. And if the result of that calculation is 25 to 29.9, you would fall in this area here, which is overweight. Now, if your BMI is between 30 and 39.9, you're obese. And if your BMI is over 40, you're categorized as morbidly obese. Now, if it's below 25, you're normal. And then if it's under a certain amount, again, I think it's 18, you're considered underweight. It's important to note that the BMI calculator doesn't take into account if you're particularly muscular or if you're going through puberty when your body is still developing. There are charts on that website, especially for teenagers, that you should refer to if you haven't done so already. But just for your own background information, here's the imperial formula, and this is the metric one that you should familiarise yourself with. So you get your weight in kilograms and divide by your height in meters squared. Just note also the conversions. 1 kilogram is 2.2 pounds, 1 foot is 12 inches, and 1 inch is 2.54 centimetres. Now let's look at how this can be calculated. This is how to calculate your body mass index score if you were to weigh 209 pounds and are 6 feet 2 inches tall. So if we get 209 pounds, we translate that into 95 kilograms, because 1 kilogram is 2.2 pounds. If you're 6 feet 2 inches tall, you are 1.88 meters, because 1 foot is equal to 12 inches and 1 inch is 2.54 centimeters. You have to square off, according to the definition says that you need to divide by your height in meters squared. So if your height is 1.88 meters, you multiply that by 1.88. You multiply it by itself. 1.88 by 1.88 equals 3.53. And then you get your weight, which is 95 kilos, divided by your height in meters squared, 3.53, is equal to a result of 26.91. Therefore, your BMI score in this case is 26.91. So when you consult the BMI chart, this result of 26.91 puts you over 25, which means you're in the overweight category. The first major cause of obesity is simply incorrect energy balance. This means that you are consuming an excessive amount of calories. The calories that you eat do not equal the calories that you burn. If the calories that you eat are greater than the amount of calories burnt, that results in weight gain. If the amount of calories that you eat is smaller or less than the calories that you burn up, that results in weight loss. Now, unhealthy eating patterns are established in childhood. And one of the main causes, of course, of obesity is poor food choices. So this can be, for example, excessive processed or takeaway foods. And often there's a correlation between people who have a low income and a busy lifestyle and obesity. Hormone imbalances are often cited as a reason for obesity. For example, an underactive thyroid, which is a medical condition, will result in weight gain. And this leads us into our fourth cause, which are medications. So some medications cause weight gain, such as blood pressure medication. We can see on the list there, very small, you've got psychotropic medications, and you also have diabetes medications there too. Emotional reasons such as depression or boredom may result in comfort eating. Our sixth cause of obesity is a lack of physical exercise. Now, the best type of exercise that you need to do every day is some kind of aerobic activity, using the large muscles mainly in your legs. Having activities that can be incorporated into your everyday life, such as walking or cycling to school, doing a little bit of gardening, walking the stairs instead of taking an elevator, are good to incorporate into your daily routine. And of course, regular daily exercise contributes towards your overall mental and physical and emotional well-being. So even if someone is not trying to lose weight, just getting into the habit of doing daily exercise is good practice for life. Being overweight or obese can increase your risk of a high number of health problems, such as high blood pressure or hypertension. And this is a major risk factor for developing a serious cardiovascular disease, diseases that affect the circulation of blood around the body. And they can contribute towards infertility, type 2 diabetes, which is a long-term condition that people have caused by too much glucose in the blood. Many types of cancer can be traced back to being obese or overweight. Different types of heart disease, when your heart's blood supply is blocked, stroke, asthma, osteoarthritis. Back pain is a huge issue for people who are overweight or obese, and depression, when you have feelings of extreme sadness or despair that last for a long time. Let's face it, people who are overweight or obese have a higher risk of being bullied by others. There's a stigmatization that's associated with being obese, which can lead to feelings of low self-esteem and a poor self-image, low confidence levels, and feeling isolated, from friends, family. And this can also be because they're not as mobile, they can't get around as fast, and therefore it becomes a vicious cycle. So this can lead to mental problems such as severe depression, which makes it more difficult to act and to get out and exercise and to counteract the obesity, which would also help their mental health too. Obesity is associated with an increased risk of stroke due to the high amount of body fat on the body, and this being overweight can lead to high blood pressure and related complications. For example, atherosclerosis, that's ATHEROSCLEROSIS, which you need to know, or a hardening of the arteries. You might wonder why carrying extra weight in the body is associated with arthritis. So why is arthritis a health risk associated with obesity? Well, if you think about the extra weight that people are carrying, this causes an extra stress on joints, particularly in the back and in the knees. Because if you think about, the knees are supporting the entire weight of the upper body. So the knees and the feet and the hips as well get it sooner than, say, the shoulder would. Okay. So you've got bone grinding directly on bone in osteoarthritis, which is different to rheumatoid arthritis, which would be passed down from generation to generation and could be to do with other hereditary factors. So when you've got this bone grinding and you've got an erosion of cartilage, an erosion of synovial fluid in between the joints, this causes extreme pain. You might also wonder, why are gallstones a health risk associated with obesity? Well, if you think about, obese people have higher amounts of cholesterol in their bile because they've consumed more fat, and they've more fat in their body. And these the cholesterol is what makes gallstones. It's an ingredient in bile. So these accumulate and gather in the gallbladder, and in fact often they appear when people are losing weight for some reason. That would be when it becomes a real issue, when they've lost an awful lot of weight. So in this half of the video, we've discussed definitions of obesity, overweight versus obese, body mass index, causes of obesity, and health risks. In the next video, we'll talk about the treatment and the dietary guidelines of obesity. Before we go on to the next section, I'd advise you to go onto bmicalculators.ireland.com, check out your BMI, and also refer to page 68 of your textbook to look at the health risks associated with obesity. There's more details there. And just to have your pen and paper ready for the second section so you can take a few notes. And to end, the stats that you need to learn are that 6 in 10 adults and 1 in 4 children are obese, and worldwide obesity has more than doubled since 1980. Consider that obesity might be a product of a more affluent society.